Well, this is really a routine procedure for me anymore. There's no shot, no anesthetic here. And patient comes in, he's got this little dark spot on his tooth and he wants it corrected. So I don't have to give him a shot because I'm using a laser, and the laser's like shining a light in your eye. All of a sudden you can't see very well. I do the same thing as I'm cutting a tooth on the nerve. The nerve shuts down and I can proceed to clean it out. So as you're looking at this, you see me go into nice small circle motions, and what I'm doing is a laser looks for water. So what I'm doing right now is I'm looking for the water in the tooth, which is primarily the decay. Decay is saturated with water and bacteria. Bacteria is mostly made of water as well. So having said that, wait a minute, I can take and sterilize this tooth as I cut it, because that laser energy is looking for water. Bugs are made of water, bacteria is made of water. So as I prep it and going in these small motions, I'm kind of getting the tooth numb a little bit, and I'm not really aggressively cutting at this point. Air dry it out. Nope, still see a little bit. Hey, let's get the slow speed in there, because this is kind of like, if there's enough decay, it's like taking your hand and punching a pillow with that laser. So I'm going to get a little more aggressive. Does he feel it? No, because I've already got that tooth fairly numb. Kind of like what I told you with the flashlight. So now that I'm going to look this, now watch this. See that little streak I'm making? The tooth is actually designed a lot more like a sponge than it is a piece of concrete. It's not as solid as you might think. It's got tubules in it. And what I'm doing right here is I'm going inside those tubules and I'm creating a decayed-free zone. There's no bacteria left. I'm actually going up, think of the sponge. I'm going up into the tubules of the sponge, making sure it's sterile. And once I do that, I just kind of take my Explorer, make sure I got it all nice and sound. And it is, I can see it. I'm actually filming this with a microscope. I do a lot of my surgeries and preparations. Now you notice the light change color. We know that our bonded material in the presence of blue light hardens. So when you see a light come on and a dentist is curing something, he's actually shining an intense blue light. Now look at this. That is just simply a flowable material that has a particle inside it that it picks up like a chameleon effect the rest of the tooth. So I don't even have to be good at picking out a shade. I can't pick out a tie on Sunday morning, but I can pick out a shade pretty good now. We cure it, polish it up a little bit with my carving burr, my finishing burr, and at that point right there, that tooth is pretty much done. Now we're just gonna come in with a buffing wheel, polish it up a little bit, and that's it. So this patient had been dreading going to the dentist, didn't want to get a shot, didn't want to get this done, didn't like to go, and guess what? That is all she wrote on that filling.